Hello and welcome to Family Forum. My name is Kim Gordy and I'm a social worker at the Town of Groton Human Services Department. I'll be your host for the next half hour or so. For this segment of Family Forum, we will be showcasing New London County Cares. New London County Cares stands for Coordinated Access, Resources, Engagement, and Support. Nlcc Cares is an initiative of the Overdose Action Team of the Health Improvement Collaborative of Southeast Connecticut, managed by Alliance for Living and Ledgelight Health District. I would like to introduce our guests. Today we have the pleasure of speaking with Trish Rios and Donnie Rose from New London County Cares. Trish Rios is a Cares Navigator from Alliance for Living. Trish is a licensed community health worker and recovery coach. She is especially skilled at community outreach and engagement, as well as harm reduction. Trish brings her lived experience as a person with over 13 years in remission from substance use disorder. Donnie Rose has been working at Alliance for Living for the past 4 years as a Cares Navigator harm reductionist. Donnie is licensed through the state of Connecticut as a community health worker. He has 16 years experience working with people who live with substance use disorder and mental health disorders. Donnie also brings his life experience to benefit in the work that's being done by having 17 years in remission from substance use disorder. Welcome. Thank you for joining me today for Family Forum.
Thanks for having us.
Thank you.
So I'd like to just start off, if you want to tell us a little bit about New London County Cares and kind of how it started.
So New London County Cares started in 2018. It's a collaboration between Alliance for Living and Ledgelight Health District. And it started with the opiate epidemic, started with the overdoses, the opiates, and it started out with 3 navigators part-time, and it was very effective. So after, I believe, like the first year and a half, we have been full-time. There's 3 of us, there's 2 navigators, and we're full-time, and we've been doing it since 2018.
That's great. And can you tell us a little about the services that you provide?
Well, the services consist of a bunch of resources that we engage with, for people that's in the community. So it can go anywhere from housing, insurance, primary care, medical-based treatment, transportation. So we try to, connect our members in the community with all the resources that is possible. We only as strong as the resources that we involved with. So this is why, it's very important as navigators that we connect with all the resources that's possible that can service our community and make things accessible to us.
Absolutely. And can you tell us a little bit about the harm reduction model and what some examples might be of harm reduction?
So harm reduction is, for me, a simple way of explaining it is accepting people for who they are. No judgment, meeting them literally where they're at, and getting their, meeting their basic needs, like making sure they have food, making sure they have a place to lay their head. I mean, depending on the person, but it's not judging people and not telling them what I think they should do. It's supporting them in what they want to do and making sure that they are respected as people.
Yeah, and Trish, gave you the roundabout figure of it. They do have a simple way of reading it here. Harm reduction is a set of practical strategies that reduce negative consequences of drug use and incorporating a spectrum of strategies from safer use to manage use to abstinence. Harm reduction strategies meet drug users where they are at, addressing conditions of use along with the use itself. Harm reduction upholds the dignity and the human rights of people who use drugs. Stigma does not have a place when it comes into harm reduction. So, harm reduction is just trying to meet people where they're at, overlooking the challenges they may face that keep them from coming forward. It's an approach of helping people that may feel a certain way, how our community and how people may look at them where they won't be able to seek the help that they need. So we as navigators, we just want to be in that position to be open, where they can be comfortable and seek all the help that's possible.
Yeah,
Yeah.
So we reduce the harm instead of causing harm.
yeah.
Very well said.
Thanks.
Language is really important. Can you speak a little bit to why it's so important when we're talking about substance use disorder?
Language is so important because for so long, the stigma that's attached to these disorders is horrific. And when you change the language from something as simple as saying, when people say, I'm clean, they haven't been using substances. Well, if you're clean now, then you were dirty before. So we try not to use that word clean or dirty. We try to use uplifting words that doesn't have so much stigma attached to it.
Yeah, and it's so true, how Trish, you know, language always matters, and it's how you approach people. You know what I mean? Dignity, people have dignity one way or another, no matter if they're in substance use disorder or not. There is a dignity that comes with it. And you know, it's a certain respect that should be always given to a human being. You know what I mean? So it matters, you know, the language really matters. You know, calling people addicts and drug abusers and junkies, that's just not acceptable.
No, they have a disease. They have a disease. Substance use disorder is a disease. Instead of educating people to use that word versus addict, junkie, dope fiend, I mean, those words really do weigh on people.
You know, some of our children are born to this disease. And you don't call them addicted babies. You know what I mean? They're born with with an abstinence syndrome.
Neonatal abstinence disorder, disorder. It's like syndrome.
For me.
Yeah, but
it's the respect, right?
Instead of a problem, it's a disease.
Yeah.
Just like diabetes, just like heart disease, just like cancer. And that's a hard one to educate the community on because there's so much negative attached to it. We want to take the negative out and have people being treated just like anyone else with a disorder.
Yeah, we speak on the language matters a lot, because we have to exercise that on a daily basis. You know, even when it comes to doing a urine test, it's not clean or dirty. There's never word dirty. You know what I mean? It's a negative or a positive drug screen. You know what I mean? And that's just how it should be approached, especially in our doctor's offices with our, primary care physicians. They should be using these type of words, and that's just how it should be done. You know what I mean? We just want to make people more aware. If we're more aware of it or be more conscious of it, then we should learn how to speak with it. And it's a way of respect. That's what we all seeking for. We all want respect, no matter what we're going through. These are disorders that, to no fault of our own, it can happen. And we just, just trying to make it very clear and educate the community and, everybody that's involved with this, that, even with our families, our children, we don't look at them in disrespectful ways. We just want them to be respected and learn how to respect themselves. Because when you start hearing certain things and somebody tell you certain things over and over, you start believing it.
Yeah,
sure.
You know what I mean? But if you are told and you are uplifted at the same time, then you start feeling a certain way about your own self, which means you start bringing yourself into a language which is respectful to yourself. So.
And that brings in the harm reduction model and meeting people where they're at and not judging them and not telling them what to do. Those things are so important because when we build relationships with our participants, using that approach, some people may not want to stop at the moment, but once they see that they're being treated with respect and they're cared about, eventually there comes a point where they're like, you know what, I think I'm ready to try treatment, medication-assisted treatment, whatever they want to, if they want to use less, right? That's a goal. Like whatever they want to do is what we're going to support you in, and try to break the barriers that come along with somebody getting the help.
Definitely.
Yeah, when a person wants help, they want to go to somebody that's going to respect them. Mm-hmm. It's hard to get help to somebody that's being very disrespectful. It just makes you not want to go that way, especially at the moment you need the help. And now you have to seek for the help, but I don't want to go to help when they talk to me that way and the last time I try to receive it. So this is why we open these doors and educate our community into certain languages and just be respectful with it.
Yeah.
Thanks.
And it can be really hard to ask for help.
Absolutely.
Yeah.
Absolutely, and that's why there's different help for everybody. Everybody has a different recovery process, being in remission, not using whatever you call your process, it's not cookie cutter. It's not the same for everybody. So what may work for me may not work for somebody else. But let's find out what's going to work for you. And if it's medication-assisted treatment, we can help you. We have instant access to the Suboxone. We have instant access to a primary care physician that is going to treat you as a person with respect and your disease and anything else that you may have going on, because we encourage our participants to see a doctor. How many people go without seeing a doctor because they don't feel they're worthy of going to the doctors, because they may be using at this time and they know, oh, I might be judged. This doctor may say whatever. So we try to build our team to be people, all the people on our team are people that are going to be supporting people for who they are.
There are multiple pathways, multiple. And like she said, man, we're just trying to find ways what fits you. Because, you only get out of it what you put in it. And if you're willing to put something in it for yourself, and then you'll find a multiple pathway that fits you, that's more comfortable for you to succeed in what your desire is at that moment.
Yes, very important. So speaking of education, can we talk a little bit about Narcan and why it's important to know where to get it, how to administer it?
So Narcan is super important to us. We carry it. I think everybody should carry it. Overdoses don't happen just in houses tucked away somewhere. Overdoses happen everywhere, and it's easy to get. It's expensive if you don't have insurance. If you have state insurance or Medicare, you can get a prescription every month, every 30 days. You can go into any pharmacy and ask the pharmacist. They will give it to you. You don't have to go to a doctor. You can get it from your doctor, a prescription, but you can walk into basically any pharmacy locally, ask them for the Narcan. They'll train you the first time you get it, and then every 30 days you can get it for free. There is co-pays, obviously, with private insurance, but we encourage people to carry it, whether it's around your neck, in a backpack, pocketbook, in your car. It's very important to have.
Especially in today's time, you're right. It's better to have it and not to need it than to need it and not have it. So we just always want it, and because overdose can take place at any time, at any moment. At your local grocery store, at your bank, in the parking lot, McDonald's, Burger King's. These are all public places that it can actually happen, and unexpectedly at a time that you may not be aware of. So, it's best to be educated with it. Very first thing is to dial 911, because time is essential. But during that process, as you dial 911, then we can go to work with what is going on with the situation and the circumstances. So this is why we always carry it. We keep it in our possession at all times. A young person, young people can use it. It's very accessible.
It won't hurt anybody. If you are not experienced in overdose, if you find somebody that signs of an overdose look like blue lips, blue fingertips, gray lips, gray fingertips, not responding to your name being called, not responding to touch, also gurgling sounds, which is also considered snoring, those are signs of overdose. And if that's what you're witnessing, then I always tell people you call 911. If you have the Narcan, it's super easy. A box of Narcan comes with 2 doses, 2 of these. So you can take it out, put it in their nose, spray. What Narcan does is the opiates tell your brain to stop breathing. It tells your lungs don't breathe. And the Narcan comes on, blows that off, and allows your brain to tell your lungs to start breathing again. Usually within the first, sometimes some people take 1 dose, 2 doses, it all depends on the person. But the point is to get the person breathing. So the Narcan works, they want to say usually 2 to 3 minutes between each dose. I say when your adrenaline is rushing, that goes by really slow. So give them a dose, they're not responding, give them another dose. If they respond, hopefully 911 will be there, because that's the first thing you want to do is call 911. and then keep them safe until 911 gets there. Nobody that I've witnessed, I've done 5 reversals myself. I've never witnessed anybody turn in violent, get up, try to hurt somebody. What I believe happens is that, it's adrenaline for them too. They're confused. They were just passed out. They're looking around. What happened? But people say, oh, I don't want to use it because I've heard they become violent. No, they're confused. They're not knowing what's going on. But I've never seen anybody turn crazy. What it does is it keeps them alive. It keeps them alive. But the most important thing, I think, also, aside from calling 911 and carrying Narcan, is allowing the person to go follow and go get the help that they need. Because Narcan lasts about 30 to 45 minutes. And if you're not in a medical place, you could go back into an overdose. So if we can play the whole tape through, I would love 911 first, give the medication, they're revived, and then go to get the hospital. So you have more someone to watch you and know that you won't go back into an overdose.
Right.
Yeah.
Yeah, because it can happen, because what it is, the opiates cover up the receptors on the brain, and when the Narcan open up the receptors. So during that process, it can close back again. So this is why, it's very important just to, keep them alert and keep them going. But, as she said, people that, get revived, you have a lot of people standing around and there's a lot of excitement and you're confused. So yeah, you might be shocked, you might be excited, but they don't wake up ready to fight and turn into some type of beast. You are scared and confused and want to know why everybody's around me and what happened. You know what I mean? So it's a state of confusion.
And if you give Narcan to somebody who is not experiencing an overdose, it won't hurt anybody. It's not going to interfere with any other health issues that person may have. Mm-hmm. It is only going to reverse an overdose. So I think that's important for people to know.
Right?
Yeah, just opioids.
Yeah, definitely. Very helpful, useful information.
Yeah.
Can you speak a little bit to the need of Narcan in Southeastern Connecticut specifically?
The need of it? Well, as we just explained, it's needed everywhere and anywhere. You know what I mean? Because opiates and fentanyl and these compressed pills have plagued the country. And this is a substance that can that does a reversal. So this is why it's a very strong need. But the drug supply is getting stronger. And and it's becoming more known. And this is why we just got to be aware of what we're dealing with. And this is why we believe it's a strong possibility that we have to have this in our possession, all across, everybody, with our schools, and in our community, inside the stores, inside the banks, no matter what facility or establishment that it might be, it should be accessible.
And it shouldn't be taboo. Like, it should be a conversation that my daughter's 12, about to be 13, and she could do a Narcan. She knows what Narcan is. She knows what it's for, and she could do an overdose reversal if she had to. So, I think it should be more normalized and not something that we shouldn't talk about. Like, don't talk about that here.
Right.
I think it should be more normalized.
Yeah, it's not something you want to tuck and hide. This needs to be sitting out and being accessible. So this is why we believe it's an important. This is why we work in the field that we work in, just, because we want people to live. We want people to have the opportunity to live, especially if you're in substance use disorder. It's a lot of hope, and, we lose people to the disease of addiction, and, and it stays with us, and we just want to be mindful that there is a way, there is hope, and you can make a difference.
Yeah.
You can make a difference, and that's a strong thing when you can make a difference in someone's life that you may care for, that you may love, and even if you don't know, you did give that person, or at least give them the opportunity to live. That's true. Yeah.
Absolutely, and I like how you said it's better to have it and not need it than to need it and not have it.
Right, you don't want to be in that position.
Out of all the trainings I've done throughout the years of being here, I've never had a group of people say, like, they don't need it, that was horrible. It's a conversation that not a lot of people are having. So when you start to normalize it, then it realizes, oh wait, maybe I do need that. Maybe my grandson, maybe my son, maybe something's going on. Maybe I should have it in the house. Maybe I should carry it. So we would rather have people have it and carry it, and then instead of later on saying I should have had it. Because I'm sure there's those conversations that happen too.
See, more as we speak about it, more scenarios can appear. You know, even with the family that, well, no, our family don't deal with a lot of that stuff and this and that. Even with our elderly, you know what I mean? It can be grandma, it can be grandpa, and you know, he's sitting there and he may have went through a surgery, hip replacement, whatever the case may be. He may have other medications that he be taking. It can be loss of memory, things of that nature. And he's taking his medication and didn't realize he just took it 10 minutes ago, 15 minutes ago, and now he takes another, on another. And he's sitting there just watching TV, and you just think he just went to sleep. He may be an overdose. You know, you start shaking him, and then, you know, like all the examples that Trish gave. Now you want to wish you had the Narcan, because now you have to dial 911, and you're not sure what is going on, because you're not used to these things. They're not familiar with it. But as she said, it can't cause harm to you if it's not an opiate overdose. But at least if you gave it to him and gave him the opportunity, it might relieve the, you know, receptors on the brain, and he can or she can come right back. And you just might have just saved your parent or your grandparent. These things is unexpected, especially when you're dealing with medications. So we're not just talking about fentanyl and, you know, street drugs. We are talking about medical prescribed drugs also that can do this with Vicodin and oxycodone. We're talking about legal drugs that can actually put you in an overdose.
Right. And also, and like going off of that, the community that we work with, we don't, we work with people who may be in what we call chaotic use, may be homeless, may have lost their job, and they're in a really hard time in their life. But a lot of the people that we work with are people who have jobs, careers, families, and they don't have the ability to go to their family members and talk about it. So they reach out to us, and I think it's important to know what kind of population that we work in. We're in Groton quite a bit. We're all over pretty much Eastern Connecticut, the New London County. But people are struggling, and even though it may not look like they're struggling, you don't know. So that's why I think it's also huge to talk about overdoses are not just people that are in chaotic use. Overdoses can happen anywhere to anyone that's using.
Yeah, definitely. Well, we had a few more minutes, but I wanted to make sure, speaking of outreach and education, could you speak a little bit to where folks can find you at the Human Services building in Groton?
So we're every other Wednesday, 11 to 1, and we're parked out there. People drive by, they beep the horn, they see us, but please stop in. We have information, we have Narcan, we have pretty much whatever you may need help with, we can usually assist people. So even if you don't need anything, just stop in, say hi. If you have questions, feel free. We're open to just talking to anybody.
Wonderful. And how can people help Nlcc?
By the media, by sharing information, and that's what it is, word of mouth sometimes, advertising, feeling open to speak on it. This is how you help us help you. Mm-hmm. You know what I mean? And you know, the community should be aware that there are services out there that they can take advantage of. And you know, and like I said, we're as good as the resources that we have, and we strive to be good at what we do. So we seek information in the weirdest places, and we get information from the streets, from the organizations, from agencies, from corporations, you know what I mean? And we just seek. This is what we do, for it can be available to you. And that's just, you know, if you know something that we may not know, feel free to contact us and let us know. This is how you help us out to help you. Very
good. And how can folks contact Nlcc?
So their number is 860-333-3494, and that will go to our supervisor, who will then send it out to us. And you can call for support, for questions, for family support, for Narcan, or to meet with any of us.
Well, thank you, Trish and Donnie. That's incredibly helpful. Thank you for sharing this very important information to the community.
Thanks for having us.
Thank you.
Absolutely. I want to thank you for spending your time with us today, and thank you for sharing that vital information.